high incidence of ischemic stroke, with alpha blocker therapy in older patients. Alpha blockers, also called as alpha-adrenergic-antagonists, are the anti-hypertensive agents. Alpha blockers may cause hypotension and cerebral hypoperfusion during the early start of the therapy. Cerebral hypoperfusion is a condition caused by the decrease in the blood flow to the brain. Cerebral hypoperfusion is one of the causative factors for ischemic stroke. The primary aim of the study is to assess the risk of the ischemic stroke with the alpha blocker during the early days of the therapy. The self-control case series design is applicable to study the adverse reactions to the drugs. Poisson regression model is a statistical analysis used to model count the data and analysis. The sample size included in the study is 7,502 older men. The analysis software used for the study is Statistical Analysis Software, version 9.2. The subjects included in the study were older men above 50 years of age, incident users of alpha blockers, and men who were diagnosed with the ischemic stroke. The study excluded men who were below 50 years of age in the patients with a pre-existing disease condition that would predispose ischemic stroke. The patients who were using antiplatelet or anticoagulation medications were also excluded from the study, as it may interfere with the results. The day on which the subjects were administered the drug was considered as the incident date. The 60 days prior to the incident date was considered as pre-exposure risk period, and the 60 days after the incident date was considered as post-exposure risk period. In the unexposed period, the subjects were not administered any drug. The results obtained through the study provides evidence that the incidence of the ischemic stroke is higher in the post-exposure risk periods and the pre-exposure risk periods. The higher number of the stroke attacks were found in the 3-month study period around the index date. The adjusted and unadjusted incident rate ratios of different alpha blockers were found to be higher in the pre-exposure risk period 1 and post-exposure risk periods. The incidence of the ischemic stroke was found to be higher in the subjects who were only on alpha blocker therapy without any other anti-hypertensive agents. The connection between the alpha blocker therapy and the incidence of the ischemic stroke is well established by the study. The incidence of the stroke was higher in patients who were using alpha blockers alone, when compared with concomitant users of other anti-hypertensive agents.